Farzana, sorry, you can start. I'm listening here. Farzana.
Can I start?
Sir,
Yeah, you can start. Yeah,
Sir, I'm here. I'm start now. My topic
yeah,
name is
yeah.
my
Yeah, step
topic
by
name is
steps.
kidney. First of all, I discuss about the kidney structure. There are two reddish brown bean-shaped organs that is found in vertebrates. They are located on the left and right in the retroperitoneal space, and in adults, humans are about 12 centimeters, but differ like 4 to 1/2 inches in length. There is the blood from the paired renal arteries. Blood exits into the paired renal veins. Each kidney is attached to a ureter, a tube that carries excreted urine to the bladder. And there is a retroperitoneal space behind the abdomen that acts as the blood to create urine. And the nephron is the structure and function unit of the kidney. Each adult human kidney contains around 1 million nephrons, while a mouse kidney contains only about 12 to 12,000 nephrons that can be participate in the volume of various blood body fluids, osmolality, acid-base balance, some other electrolyte that can removal of toxicization, and also it can filtration that occur in the glomerulus, and it can be the 1/5 of the blood volume that enters the kidney is filtered, like some examples of the reabsorption of solute free water, sodium bicarbonate, glucose, amino acids, and also like hydrogen, ammonium, potassium, uric acid. And it can also carry out function like independent of the nephron. Some another example, like they can convert a precursor of vitamin D to the active form like calcitrol, synthesize the hormones, and also it can be like erythropoietin and renin proteins. These can be filtrate. And about the renal physiology, can we discuss? It is the study of kidney function, that is nephrology, and it is a medical specificity that this can include chronic kidney disease, nephrotic syndromes, acute kidney injury, and nephritis. These are the some renal physiology, nephrology, and it can be the dependent on the urology. That can be the is the term like the disease of kidney, in which we discuss about the urinary tract, like cancer, renal cysts, kidney stones, ureteral stones, and urinary tract obstructions. And can we when we discuss about the procedure, it can include the estimation of glomerulus filtration rate that can be using the serum creatinine. It is the most important method in the kidney filtration, and kidney biopsy and CT scan that can also evaluate for abnormal anatomy, dialysis, kidney transplantation, and also kidney failure. That was the one of the these almost which can be renal function drops below 15%. There is a term like nephrotomy. It is frequently used to create renal cell carcinoma, because in humans the kidneys are located high in the abdominal cavity. Then it can be used these processes, one on each side of the spine, and lie in retroperitoneal position at a oblique angle. And it can be caused by the position of the liver. Typically, sometimes the liver can be enlarged, swelling. These can causing the results, and that results in the right kidney being slightly low and smaller than the left, and another like slightly more to the middle than the left kidney. The left kidney is approximately at the vertebral level of T12 to L3. When it can be lower than the right, then it can be just below the diaphragm and posterior to the liver. It can causes the positions of the kidney failure, and can also be protected by the 11th and 12th ribs. Each kidney with its adrenal gland is surrounded by two layers of fat, like someone is peritoneal fat, one, and the second one is between, which is renal fascia and renal capsule, like peritoneal fat that is superior to the renal fascia. Like kidney, about discussion of the shape, it is a bean-shaped structure with a convex and concave border. It can also a concave border in the renal hilum, which can be the renal artery that enters the kidney, and the renal vein and ureter leaf. And the kidney is surrounded by tough fibrous tissues, the renal capsule. It can be included the peritoneal fat, renal fascia, as we discussed above about the two layers of the kidney surrounded. The anterior surface of the tissues is the peritoneum, and the posterior surface is the transversalis fascia. That is the posterior rear side, and the superior pole of the right kidney is adjacent to the liver. If we discuss about the left kidney, it can be next to the spleen because it moved on upon inhalation. In male and female, the weight of the kidney is different because is in male is 80 to about 160 gram, and of right kidney and left kidney is 80 to 175 gram. But in female it is different because there's a reference range like 40 to 175 in female right kidney and 35 to 190 gram it in left kidney. Because there's a left side on the and there's inches, and there are also differences. The functional substance of the kidney is divided into two major structures like outer renal cortex and the inner renal medulla. These two main structures of the kidney. It is a shape of 18 cone-shaped structures like renal lobes, each containing renal cortex surrounded by a portion of middle area like medulla called renal pyramid. Between the renal pyramids are projection of cortex called renal columns, and also nephrons, that is the urine-producing functional structure of the kidney that can span the cortex and medulla. The initial filtering portion of a nephron is the renal capsule that is located in the cortex. This is followed by a renal tubule that passes from the cortex deep and this into the medullary pyramids, that is a part of the renal cortex. A medullary ray, that is a collection of renal tubules that drain into a single collecting duct, main duct. The tip or papilla of each pyramid optimize urine into a minor calyx. Minor calyx is empties into major calyces, and major calyces empties into the renal pelvis. It is the process of the urine flow. This becomes the ureters, that is the main single collecting duct. At the hilum, the ureter and the renal vein exit the kidney, and the renal artery enters. Where there is also a hilar fat and lymphatic tissues with lymph nodes that can surround these structures. And the hilar fat is contagious with a fat filled cavity that can be the renal sinus, and it can also connect to the renal pelvises of the medullary tissues. Discussion about the blood supply of the kidney that can receive blood from the renal arteries left and right both sides, which branch directly from the abdominal aorta, and relatively small size despite of the kidney because it approximately 20% of the cardiac output. That is a major line of the kidney importance can it can control. And each renal artery branches into segmental arteries which penetrate the renal capsule and extend through the renal columns between the renal pyramids. The interlobular arteries then supply blood to the arcuate arteries that run through the boundary of the cortex and the medulla, that the covering of the kidney. Each arcuate artery supplies several interlobular arteries that feed into the efferent, efferent arteries. Efferent means arrival that supply the glomeruli, and efferent that can exit the artery from the medulla glomerulus. It called the efferent arterioles. Blood drains from the kidney ultimately into the inferior vena cava. That is also superior vena cava. After filtration occurs, the blood moves through a small network of small venules that converge into interlobular veins. It can be the veins follow the same pattern. Interlobular provide blood to the arcuate veins and it back into the interlobular veins, which come to form the renal veins, which exiting the kidney. The kidney and nervous system also relate because via the renal plexus through the some renal arteries to reach each kidney. The sympathetic nervous system trigger vasoconstrictions in the kidney, thereby reducing renal blood flow. The kidney also receives input from the parasympathetic nervous system, and also there is a renal branches of the vagus nerve also play role in the function of the yet and clear because there is sensory input from the kidney that travels from the to T10 to T level, that can levels of the spinal cord and is sensed in the corresponding dermatate and thus plain in the flank region and can also corresponding kidney. Renal histology is the also discussion of the study of microscopic structure of the kidney. like kidney glomerulus parietal cells included kidney glomerulus podocyte, loop of Henle, think ascending limb, kidney distal tubule, collecting duct. These are the further process that can be play role in the kidney function main. And there's about 20,000 proteins coding genes are present in human cell. That is almost the genes are expressed in the normal in kidneys. Yeah, just our 300 genes are more specifically expressed in the kidney with only some 50 genes, and some are specifically for the function of the some parts of the kidney. And proteins are expressed in the cell membrane and function because it acts as a transporter protein. The highest expressed kidney is the uromadoline, that is the most abundant protein in urine with function that prevent calcification and growth of bacteria. And some specific proteins are also expressed in the different compartments of the kidney with podocin and nephrin that is expressed in glomeruli. Solute carrier, also a family protein in the in the proximal tubules. It can also like albumin, it can express in distal tubules play a role, and aquaporin that can express in the collecting duct cells. The because these proteins some play role in each part in the specific parts. And then also kidney develops from the intermediate can be discussion. It can be included in the excrete variety of waste products produced by metabolism in the urine. The microscopic structure and functional unit of the kidney is the nephron, as we discussed above before, because there's a filtration, reabsorption, secretion, excretion. It is the main process and the function of the kidney. Is the production of urine. It can include nitrogenous waste, urea from protein catabolism, uric acid, nucleic acid metabolism, the ability of some other volume of blood from with the waste that can be extracted, and some several independent nephron characteristics that can operate a it can also be used in the sending lymph for the coagulation and exchange by the vessels carrying the blood supply to the nephron, and also enabling the function. It can also participate in whole body homeostasis, metabolism, regulating acid base balance, electrolyte concentration like some extracellular fluid volume, blood pressure, the kidney alkalization, and the homeostatic function both independently in contact with the some endocrine organs also include, and some hormones like renin, angiotensin 2, aldosterone, antidiuretic hormone, arterial neurotrophic peptide, and some others also play role. Filtration. If we discuss details of the function of the kidney, like filtration which take place at the renal capsule, it is the process by which cells and large proteins are retained while materials of smaller molecular weights are filtered from the blood to make an alpha-filtrate that eventually become urine. And kidney becomes 180 liter of filtrate a day. The process is also known as hydrostatic filtration due to the hydrostatic pressure exerted on the capillary vein. There is a urea, uric acid, amino acid, proteins, vitamins, lactate. It can be filtrate. And reabsorption, then the next process is reabsorption. Reabsorption is the transport of molecule that can be from the unfiltered and into the peritubular capillary. Is accomplished via selective receptors on the luminal cell membrane. Water is 55% reabsorbed in the proximal tubule. Glucose at normal plasma level is completely reabsorbed in the proximal tubule. The mechanism for this is sodium to glucose concentration. It is transporter and plasma level of 350 gram with fully saturate the transporters, and glucose will lost in the urine. Plasma glucose level of approximately 160 is sufficient to allow glucose, which is an important clinical in the diabetes mellitus. Amino acids are also reabsorbed by sodium dependent transporters in the proximal tubule. There is a deficiency. There is a someone disease like Harnett disease. There is a deficiency of tryptophan amino acid and transporter, which result in Filergia, like it is a disease which can be included, and proximal timule, which is glucose 100% reabsorbed, amino acid 100%, bicarbonate 90%, chloride 65%, phosphate 65%, water 65%, and about PTH, it can inhibit the phosphate reabsorption, and it stimulates sodium, water, and bicarbonate reabsorption. And in the descending
Okay,
loop
thank
of
you.
family.
Thank you, Farzana. Ali
Yes,
Haider
sir.
Khan. Ali Haider Khan, please.
Yes, sir.
You can start.
Yes, sir.
Minimum
So my
50
topic
minutes,
is
please.
urinary bladder. Urinary bladder, or simply bladder, is a hollow muscular organ in humans and other vertebrates that stores urine from kidneys before disposals by urinations into the human bladder. Is a hollow distensible organs that site on the pelvic floor. Urine enters into bladders. And sir, urinary bladders, that urinary bladder muscular scabs in the pelvis just above the behind the pubic bone. When empty, the bladder is about the size and shape of pear. Urine is made in the into kidney, travels down in two tubes called ureters to the bladder. That bladder stores urine, allowing urinations to be in frequency controlled. That bladder is lined by layers of muscle tissues that sketch to hold urine. The normal capacity of bladder is 400 to 600 ml. During urinations, the bladder muscles squeeze into sphincters values open to allow urine to flow out. Urine exits the bladder into which carries urine out of the body because it passes through the penis. Urethra is long into men 8 inches, then in women 1.5 inches. Bladder conditions, gastritis, inflammations or infections of bladder causing acute chronic pain, discomfort, urinary frequency or hesitancy. Urinary stones uh, may form in the kidney and travel down into bladder. If kidney stones block urine flow to from the bladder, they can cause pain. Bladder cancer, tumor in the bladder is usually discovered after blood is found in the urine. Cigarette smoking, workplace chemical exposures causes most cases of bladder cancer. Urinary incontinence, uncontrolled urinations, which may be chronic urinary incontinence, can result from many cases. Overactive bladder, the bladder muscles squeeze uncomfortably, causing some urine to leak out. And esters, overactivity is a common cause of urinary hematuria. Blood is the urine. Hematuria may be harmless, may be caused by the infections. Serious conditions like bladder cancer, urine does not exit the bladder normally due to blockage or suppressed bladder muscles activity. The bladder may swell to hold more than a quart of urine. Gastrol, weakened pelvic muscles, usually from childbirth, allow the bladder to press the vagina. Problems with urinations can result bed wetting. Unnatural bed wetting is defined as the child age of 5 or over who wets the bed at least 1-2 times a week over at least 3 months. Pain or discomfort during urinations due to infections, irritations, inflammations of the bladder, or external genetics. Bladder test. The basic test of urine is done both routinely and when looking for the problems. Either bladder, kidney. The first part of test is stick. It is abnormal in urine should be looked at under a microscope. A narrow tube is passed through the urethers and into bladder. A light camera tools allow the doctor diagnose and treat bladder problems. A series of test urinations usually down in a doctor office. Urine flow, pressure, blood capacity, and other measurements can help identify bladder problems. Narrow tube is passed through ureters into bladders. Light camera and tools allow to a doctor diagnose and treat bladder problems. Bladder cancer generally requires surgery. Some cases of urinary continuous and castrols may also be treated with surgery. If urine outflow is obstructed, may be necessary to relieve pressures in the bladder. Medicines can help relieve some bladder overactivity in continuous exercising the pelvic muscles as well as stopping your urine stream may improve urine in continuous. Yes, sir.
I'm here. Then don't stop. Sir. Ali Feder, please.
Yes, continue, sir.
Yeah. Is it
Yes, sir.
possible? It will be cool, man. Sorry.
Yes, sir. Yes, sir. I continue, sir. In structure, human bladder is organ situated on the basis of pelvic gross anatomy. The bladder can be divided into board of fundus, body, apex, neck. The apex is directed forward toward the upper part of the pubic symphysis and form. There is median umbilical ligaments continues onward back of the anterior abdominal wall to the umbilicus is carried it from the apex on the abdominal wall to form the middle umbilical fold. The neck of bladder is the area at the base of that surrounds that internal urethral orifice that leads to the male neck of the urinary bladder is next to prostate gland. The bladder has three openings. The two urethers enters the bladder at the urethric and then enters at the trigone of the bladder. These openings have muscular flaps in front of them that act as values in preventing the backflow of urine into ureters, known as reflux between two openings is raised area of tissues called crest. This make upper boundary of the trigone. Trigone is an area of smooth muscles that forms of flow of bladder above the area of smooth tissues, easy flow of urine into from this part of the bladder in construct irregular surface formed by the recused walls of the bladder have series of thick muscular folds known as that allow for the expansions of the bladder. Diasters muscles, muscular layers of the wall may made of smooth muscles fibers arranged into the spinal longitudinals and circular bundles. The muscles is able to change its length. It can contract for a long time, holding and it stays relaxed. Bladder is filling the wall of urinary bladder is normally 3.5 millimeter thick. When distended, the wall is normally less than 3 millimeter. In men, prostate gland lies outside the opening from the middle lobe of the prostate causes elevations. Mucous membrane behind the internal caldale of urinary bladder can enlarge when the prostate becomes enlarged. The bladder is located below the peritoneal cavity near the pelvic floor and behind the pubic. It lies in front of, separated by the rectovascular pouch and supported by the fibers of and of prostate gland. In women, it lies in front of ureter, separated by the vesico-uterine pouch, and it is supported by the elevator and the upper part of the vein. Blood and lymph supply. The bladder receives blood by the vesicular arteries and drained into a network of vesical veins. The superior vesical artery supplies blood to the upper part of the bladder, and lower part of the bladder is supplied by the inferior vesical artery, both of which are branches of internal iliac arteries. In females, uterine and vaginal arteries provide additional blood supply. Begins into network of small vessels on the lower lateral surface of the bladder and travel which the lateral ligaments of bladder internal iliac veins. Lymph drained from the bladder begins into a series of networks throughout the muscular muscles layers, then from three sets of vessels. One
Okay,
set.
thank you. Enough. Thank you. God bless you. Farzana Nasir Ali Khalifan. Next
Okay, sir.
professor is Aisi Muhammad. Aisi Muhammad. Hi. Aisi Muhammad.
Yes, sir.
He can start. Minimum activity is 15 minutes just. Welcome.
Okay, sir. Sir, can I start from the kidney?
Yes.
Okay, sir. The main organ in the urinary system is the kidney. Kidney is consists of the small millions of the small tubules. We call them nephron. The kidney is a tubular gland containing about 1.2 million nephrons. Each kidney weighs about 160 gram and measures about 10 centimeter long and 5 centimeter in width and 2.5 centimeter thick. The lateral surface is convex and the medial surface is concave. And we call that hilum, where it receives the renal nerve and the blood vessels, lymphatics, and the ureter. The kidney is protected by the 3 layers of the connective tissues of fibrous renal fascia, and deep to the peritoneum binds the kidney and associated organ to the abdominal wall. Second is the adipose capsule. It is a layer of the fat which provides the cushion to the kidney and hold it in its particular place. And number third is the renal capsule. It is a fibrous sac encloses the kidney like a wrapper. It encloses the kidney as a wrapper and anchored at the ileum, and it protects from the trauma and infections. Collagen fibers extend from the renal capsule through the fat to the renal fascia. The renal fascia is fused with the peritoneum ventrally and with the deep fascia of the lumbar muscle. Thus, the kidney is suspended in the place. Although the kidney is the blood supply of the kidney is approximately 0.4% of the whole body. But it receives the 21% of the blood about each cardiac output. Now we move towards the nephrons. Nephron consists of the 2 parts, a renal corpuscle which filters the blood plasma, and second is the renal tubule which converts the filtrate into urine. Now we move to what is the filtration. Glomerular filtration is the passage of fluid out of the bloodstream into the nephron, carrying filtering the waste waste of the which is present in the blood, and the chemicals which are useful to the body, it reabsorbs from the from the nephron and sent back to the into the blood. The fluid filters from the blood is called the glomerular filtrate. Tubular reabsorption or the tubular secretions are the two simultaneously process that alters the composition of the tubular fluid. Substances useful to the body such as glucose are reabsorbed from the tubular fluid and returned to the blood. And the blood substances such as hydrogen ions and some drugs, they are extracted from the peritubular capillaries and secreted into the tubular fluid. And ultimately it becomes the part of the urine. In some situation where when we take the low amount of water, then the water conservation also occurred by the kidney. And this is achieved by reabsorbing the amount of water from the urine so that the body can eliminate the metabolic waste without losing the excess water. Water reabsorption occurs in all parts of the renal tubule, but in the final change occurring in the urine, and it passes through the collecting duct. The fluid is regarded as urine and enters into the duct, which we called as the ureters. There are each kidney has the one ureter, and that both kidney has a separate ureter. The renal pelvis funnel urine into ureter, a retroperitoneal muscular tube that extends to urinary bladder. The ureter is about 25 centimeter long and reaches a diameter of the 1.5 centimeter near the bladder. The ureter passes the dorsal to the bladder and enters it from below, penetrating obliquely through its muscular wall and opening into its floor. A small flap of the mucosa act as a valve at the opening of the each ureter into the bladder. The ureter has a 3 layers. Outer is the adventitia, inner is the muscularis, and the second most is mucosa. The adventitia is the connective tissue layer that binds it to the surface surrounding the tissue. It blends with the capsules of the kidney at the superior end of with the connective tissue of the bladder wall. The muscular consists of 2 layers of the smooth muscle, and the third layer appears to be the lower ureter. The innermost layer consists of the longitudinal muscle cells, and next layer is superficial to this and have a circular arrangement. Now, from the ureter, the urine moves toward into the urinary bladder. Now we discuss about the urinary bladder. The urinary bladder is a muscular sac, and it is present on the floor of the pelvic cavity, inferior to the peritoneum and dorsal to the pubic symphysis. It is covered by the parietal peritoneum on its flattened superior surface and by the fibrous adventitia. Its muscular layer is called the detersor. It consists of 3 separated layers smooth muscle. The mucosa has the transitional epithelium. When the bladder is empty, this epithelium is 5 to 6 cell thick, and mucosa has the wrinkles called the rugae. When the bladder fills, the stretching smooth out the rugae and epithelium thins to about 2 to 3 cell thick. The bladder is highly distensible organ, capable of holding about 800 ml of the urine. Next part is the urethra. When the urinary bladder becomes full, or maybe about 700 to 800 ml urine is filled in the ureter, and then due to response, the urine comes towards the urethra. The urethra conveys the urine out of the body. In female, it is about 3 to 4 centimeters long and bound to the anterior wall of the vagina by the fibrous connective tissues. Its opening is called the external urethral orifice, and it lies between the vaginal orifice and clitoris. The male urethra is about 18 centimeters long and has 3 regions. The prostatic urethra, that begins at the urinary bladder and passes for about 2.5 centimeters through the prostate gland. And in male, it is also for uses for the passing of the semen fluid. Second part is the spongy urethra. It is about 15 centimeters long and passes through the penis to external urethral orifice. It's named for the corpus spongiosum, and it has a erectile tissue that surrounds the penile urethra. The male urethra is a S-shaped. It passes downward from the bladder, turns interiorly as it enters the root of the penis, and then turns about interiorly. And it's turn about 90 at the angle of the 90 downward, and it enters into the external parental part of the penis. The mucosa has the traditional epithelium near the bladder. That is enough, or can I explain further? Now we move towards the disorders of the urinary system.
Dr. Muhammad, enough.
Okay, sir.
Tabassum asthma. Tabassum asthma. Tabassum asthma. Tabassum asthma. Hello.
Sir,
Okay, you can start. I'm listening. I'm here. I'm checking your activity.
Okay, sir. The kidney is composed of tubular gland containing about 1.2 million functional excretory units called nephrons. Each kidney weigh about 160 gram and measure about 10 centimeter long, 5 centimeter wide, and 2.5 centimeter thick. About the size of a bar of a bar soap. The lateral surface is convex while the medial surface is concave and has a slit, the hilum, where it receives the renal nerves, blood vessels, lymphatic, and ureter. The kidney is protected by 3 layers of connective tissue, fibrous renal fascia, and the adipose capsule and the renal capsule. The renal parenchyma, the glandular tissue that forms the urine, appears C-shaped in frontal section. It encircles a medial space, a renal sinus occupied by blood and lymphatic vessels, nerve and urine collecting structures. Adipose tissue fills the remaining space in the sinus and holds these structures in place. The parenchyma is divided into two zones, an outer renal cortex about 1 centimeter thick and inner renal medulla facing the sinus. Extension of the cortex called renal columns project towards the sinus and divide the medulla into 6 to 10 renal pyramids. Each pyramid is conical with a broad face, the cortex, and the blunt point called the renal papilla. Although the kidney accounts for only 0.4% of the body weight, they receive about 21% of the cardiac output. This is a hint of how important the kidney are regulating blood volume and composition. The larger division of the renal circulation are shown in the larger division of the renal circulation, and each kidney is supplied by a renal artery rising from the aorta just before or after entering the hilum. The renal artery divides into a few segments, and each of these give rise to a few interlobular arteries. And interlobular arteries penetrate each renal column and travels between the pyramids toward the cortex medullary junction, the boundary between the cortex and the medulla. Along the way, it joins again to form accurate arteries, which makes a sharp 90 angle bend and travel the base of the pyramids. Each arcuate artery gives rise to the several interlobular arteries, which pass upward into the cortex. Innervation. Renal nerves arise from the superior mesenteric ganglion and enter the hilum of the each kidney. They follow branches of the renal artery and innervates the afferent and efferent arterioles. These nerves consist mostly of the sympathetic fibers that regulates the blood flow into the and out of each nephron and thus control the rate of the filtration and urine formation. So it is enough. Or next. The urinary
Don't stop.
bladder.
Okay, thank you. Amrat Haq. Enough. Amrat Haq,
Yes,
you can start.
sir.
Okay, guys, try to give me
Okay,
activity
sir.
like for 12 or 15 minutes, okay? You can start, Amrat Haq.
Okay. The kidney are the bilateral. The kidneys are bilateral organs placed retroperitoneally in the upper left and the right abdominal quadrant and are the part of the urinary system. Their shape resembles a bean, where we can describe the superior and inferior poles as well as the major convexity pointed laterally and the minor concavity pointed medially. The main function of the kidney is to eliminate excess bodily fluid, salts, and byproducts of the metabolism. This makes the kidney key in the regulation of the acid base balance, blood pressure, and many other homeostatic static parameters. Functions eliminate toxic metabolites through urine regulation of the blood hemostasis and the blood pressure, production of the some hormones. Arteries, the renal arteries bunch of the abdominal aorta, a renal vein drains the inferior vena cava, innervation renal plexus, a clinical relation, the third kidney, horseshoe kidney, kidney agenesis, kidney stones, or acute kidney failures. The kidney is very important organ in regards to body homeostasis. It participates in the vital process such as the regulation of the blood or also osmolarity and pH regulation of the blood volume and the blood pressure, production of the hormones, and the filtration of the foreign substance. Main kidney functions: blood pressure regulation regulates the amount of the fluid in the body by increasing or decreasing the urine production. Hormones production, calcitron, active forms of the vitamin D. Erythropoietin stimulates the bone marrow to produce blood cells. Acid-base balance regulation maintain the pH of the blood at 7.4 by decreasing or increasing the excretions of the hydrogen ions. In general, the amount of the blood in the body is 5 liter. And any excessive amount of the fluid will increase the pressure on the arterial wall and cause the blood pressure to rise. Hypertension, luckily, the kidney also feels this increase of the pressure, and in case when this happen, they increase the filtration rate of the blood and production of the urine, which subsequently leads to the increased fluid excretion and decrease of blood pressure. Of course, if the situation is above the way, less than 5 liters of the blood pressure is too low. Hypotension is the stimulus for the kidney to increase the retention of the fluids and then increase the blood pressure. Beside the blood volume and the pressure regulation, kidney also participate in the production of the calcitron cell in our the body. An increased amount of the hydrogen ion can acidify the blood and cause the state called acidosis. Kidney has a special system for the excretion of the hydrogen ion. These kidney functions can be over. Kidney has their interior and the superior surface. The interior surface faces toward the interior abdominal wall, whereas the posterior surface is facing the posterior abdominal wall. These surfaces are separated by the edges of the kidney, where are the major convexity laterally and minor concavity medially. The center of the minor concavity is marked as the hilum of the kidney, where the renal arteries enter the kidney, and the renal veins and the urethra leave the kidney. The kidney are the position peritoneally, meaning they have the wrap with the peritoneal layers, the way most abdominal organs are, but rather are placed behind it. On the other hand, kidney has also relationship with peritoneum, or precisely with the specific organs that are covered with the peritoneum, which are placed directly adjacent to the kidney. External anatomy: if we examine someone kidney with ultrasound, we must know to find them, since the peritoneally easiest way to examine them. In the form the patient back, the kidney are located between the transverse process of the T12 to L3 vertebra, with the left kidney typically positioned slightly more superiorly than the right. This is because the liver and the stomach offsets the symmetry of the abdominal, with the liver forcing the right kidney a bit down and the stomach forcing the left kidney a bit up. The superior poles extremities T12 of the both kidneys are more medially pointed toward the spine than the inferiorly poles extremities L3. The hilum of the kidney usually project at the level of the L2 vertebra. Thus, the urethra is seen paravertebrally, starting from the L2 and going downward. Borders of the kidney are bean-like structure. Like the kidney has two borders, medially and the lateral. The lateral border is directed toward the periphery, while the medial border is one of the directed toward the midline. The medially border of the kidney contain a very important landmark, the hilum, the most superior vessels in the renal vein, which exists the kidney. Under it is the renal artery that enter in and under the arteries is excited urethra. Alternatively, the interior to the posterior orientation follows the same pattern: renal vein, renal artery, and urethra. It is important to remember this order of vessels and the ducts, since this is the only thing that will make you able to orient the kidney and differentiate the left one from the right one when they are outside the cadaver. Kidney tissues is protected by the three layers. The interiorly surround the kidney, the fibrous capsule, renal capsule, the perinephric fat, perirenal fat capsules, the renal fascia, which beside the kidney also enclose the suprarenal gland and its surrounded fat. Outside the fascia is the most superficial layer, a layer of the fat tissues called the perinephric fat. This layer sits posteriorly and the posterior laterally to each kidney and separate it from the muscles of the abdominal wall. Anatomical relationship: the kidney will share the abdominal structures. Right kidney anterior surface, the kidney in the C2 is same as they are cultured with all abdominal organ. Relation of the kidney with all other organs are often found in the anatomy test. For that reason, we got our covered with the kidney interior surface. Right kidney relations: right suprarenal gland, superior pole, peritoneum, superior one half of the interior surface, descending duodenum, center of the interior surface, right colic fissure, lateral part of the inferior pole, jejunum, medial part of the inferior pole. The highest portion of the superior pole is covered with the right suprarenal gland. The superior one half of the interior surface is in connect with the layer of the peritoneum that separate it from the liver. The peritoneum space that separate the liver from the right kidney is the hepatorenal pouch of the medicines. Under normal condition, the pouch is empty, while certain pathological conditions such as the ascites, hemoperitoneum can cause fluid to collect within the pouch. This is called the visualization with the ultrasound or the CT. At exactly the center of the interior surface, imagine the horizontal strips that extend from the medially concavity towards the center of the lateral convexity. This is the area of the kidney that is directly touched by the retroperitoneal posterior walls of the descending duodenum. The lateral part of the inferior pole is directly contacted with the right colic fissure, is also known as the hepatic flexure, which is also the rectoperitoneal at this part. The rest of the interior pole is associated with the peritoneum of the small intestine, more precisely the jejunum. Left kidney interior surface, since the abdominal organs are not appeared, the left kidney is not related to the same organ as the right kidney. Left suprarenal gland, upper one half of the superior pole, stomach, medial part of the lower half of the superior pole, spleen, lateral part of the lower half of the superior pole, pancreas, center of the interior surface, splenic flexure of the descending colon, lateral part of the inferior half of the interior surface, jejunum, medial part of the inferior half of the interior surface. The interior surface of the left kidney has the following anatomical relationship. The highest part of the superior pole of the right is also covered with the left suprarenal gland. F, the inferior part of the superior pole contacts with the peritoneal of the stomach medially, and the spleen laterally, just inferior to the stomach, and spleen impression is where the left kidney directly contacts the pancreas. The lateral part of the inferior half of the interior surface is directly associated with the left colic flexure, also known as the splenic flexure, and the descending colon. The medial part of the inferior half and the inferior poles are contacted by the peritoneum of the jejunum. arteries, subcutaneous arteries, two bones, 11th and the 12th rib, nerves, subcostal, iliohypogastric, and the ilioinguinal nerves, muscles, diaphragms, psoas majors, quadratus, lamborum, or transversus abdominis.
Okay, thank you. Enough. Thank you. Asif Iqbal.
Yes, sir.
Please,
Yes,
you can
sir.
start from
Okay,
kidney
thank you, sir.
and so on.
Okay, thank you, sir. Urinary system. So, urinary system is a system composed of pair of kidneys, a urinary tract. The kidney filter the blood to remove the metabolic waste. They modify the resulting fluid, which lowers the organs to maintain fluid, electrolyte, acid base, blood pressure, hemostasis. This process produces urine and fluid that consists of water, electrolyte, metabolic waste. Then the remaining organs of the urinary system, those of urinary tract, transport, store, and eventually eliminate urine from the body. In this module, and for the system structures, if we talk about these, so the kidneys are situated against the posterior abdominal wall and the retroperitoneal. So organs they located posterior to the peritoneal membranes. So however, the two kidneys differ slightly in positions. The left kidney extend from above, whereas the right kidney the left kidney extend from T12 to L3, whereas the right kidney sides slightly lower on the abdominal wall because of the position of the liver. The superior portions of the kidney are partially protected by the 11th and 12th pairs of the ribs kept by adrenal gland. These glands perform functions and secrete a variety of the hormones. So the through one of the two ureter tubes. They run along the posterior body walls, connecting the kidney with the hollow urinary bladder. The bladder which stores the urinary site on the floor of the pelvic cavity. Urine is expelled from the body through the tube called the urethra, which connects the urinary bladder with the outside of the body. So if we discuss the little bit function of the urinary system, then we will know about the removal that they do removal of the so the kidney filter the blood, removing metabolic waste. These waste are eliminated from the body via urine, and they regulate cause the regulation of the fluid and electrolyte balance. The kidney regulate blood solute concentration by conserving the eliminating water and electrolytes such as sodium, potassium, and calcium ions. Regulation of the acid-base balance. The kidney assists in long-term regulation of the blood pH by conserving or eliminating hydrogen ions and bicarbonate ions. Maintenance of the blood pressure. The kidney directly influence systemic blood pressure through their control of the blood volume. Additionally, they secrete enzymes influence both blood volume and peripheral resistance. So they also maintain the regulation of the erythropoiesis. The kidney regulates the blood cells production in the bone marrow by releasing the hormone of the erythropoietin and performing other metabolic functions. The kidney play many important metabolic roles in detoxification of substances in the blood, activating vitamin D, and making new glucose through the process of the glycogenosis. So if we talk about the anatomy of the kidney, and then we will know that the kidney are held in a place on the posterior body wall and protected by the three external layers of the connective tissues from superficial to deep. These layers follows as renal fascia. The renal fascia is a layer of the dense irregular connective tissues. So adipose tissue capsule, the middle and the thickest layer called the adipose capsule consists of adipose tissues which are wedges and each kidney in place and shielded from the physical shock. So the renal capsule is extremely thin layer of the dense irregular connective tissues that covers the exterior of the each kidney like plastic wrap. It protects the kidney from the infection and physical traumas. Without its connective covering, a typical adult kidney is about the size of a large bar of the soap, around 11 centimeter long or 6 centimeter wide. So internal anatomy kidney, a frontal section of the kidney reveals three distinct regions of these organs: the outermost renal cortex, the middle renal medulla, the inner renal pelvis. Together, the renal cortex and the renal medulla make up the forming a portion of the kidney. The renal pelvis and the associated structures drain urine, and the cortex and medulla have formed. Within the renal medulla, we also find some cone-shaped renal pyramids, also called medullary pyramids, which separate from the one another by a renal column on each side. The renal cortex and the renal medulla of each kidney contain 1/1 million microscopic filtering structures called nephrons. So these are the functional unit of the kidney. Each one is capable of filtering the blood and producing urine. Shows the structure of the protein, which consists of two main components: the globe-shaped corpuscle and the long snack, long snacking tube of the epithelium called the renal tubule. The tip of the each renal pyramid taper into the slender papilla, which border on the first urine draining structure, a cup-shaped tube called mirror calyx, and urine from 3 to 4 minor calyxes drain into a larger major calyx. So 2 to 3 major calyxes in turn drain urine into the large collecting chamber that is the renal pelvis, which leads into the ureter. Smooth muscle tissues in the walls of the renal pelvis contract to help and propel urine toward the ureters. Both calyces and renal pelvis resides in the renal sinuses. If we talk a little bit about the nephrons, which are the functional unit of the kidney. So the renal corpuscle is responsible for the filtering the blood. Each globe-shaped renal capsule consists of two parts: glomerulus and the outer sheath of the epithelium tissues called the glomerular capsule, or inside is also called Bowman's capsule. The glomerulus is a group of the looping fenestrated capillaries. The capillaries are called fenestrated because pores or fenestrations or windows inside it present within their plasma membrane. Between their endothelium cells, these fenestration, which makes the capillary extremely leaky or permeable, form a main part of the filtering structures of the renal corpuscle. Surrounding the glomerulus is a double-layered glomerular capsule, which consists of the outer parietal layer. There are two parts: proximal tubule of the nephron, proximal and distal. The initial longest segment of the renal tubule through the which a filter flows. The proximal tubule, it consists of the simple cuboidal epithelium cells with the prominent microvilli. This part of the tubule has both convoluted or coiled or straight sections, which is why the text uses of the border terms proximal tubule rather than the proximal convoluted tubule. The many microvilli projecting into the lumen of the proximal tubule form a brush border, so named because of the fine projection resembles the bristle on brush. So the border greatly increase the surface area of the glomerulus. Nephron loops of the annuli, the main loop, the remaining filtrate flows onto the nephron loops, also known as a loop of annuli, which is the only part of the renal tube that dips into the renal medulla. So the nephron loops has two limbs. The descending limb travels toward the renal medulla, turns at 180 degree, and limb which climbs towards the renal cortex. So the descending limb is composed of the also thin descending limb. In some nephrons, this thin segment also form the band region part of the ascending limb. So there is a thin ascending limb. However, the majority of the ascending limb is composed of the thicker simple cuboidal epithelium and is therefore referred as a thick ascending limb. So type of the nephron, if we discuss, then about 80% of nephrons are cortical nephrons, so named because they are located primarily into the renal cortex. So the renal corpuscles of the cortical nephrons are situated in the outer renal cortex, and they have very short nephrons loops and just deep into the superficial part of the renal medulla, supply blood to the nephrons loops of the cortical nephrons. Although they exchange materials through the interstitial fluid rather than the directly. So the other less numerous type of the nephron in the kidney is the juxtamedullary nephron, so that the renal corpuscle of the juxtamedullary nephron sites close to the boundary between the renal cortex and the renal. In addition, it has a long nephron loop that burrow deeply into the renal medulla. Here, the loop is surrounded by a ladder-like network of the capillaries called the vasa recta, so which arises from the each afferent arterioles. So about the renal physiology, I told, and filtration membrane filtrate, also fenestrated glomerulus capillary endothelium. Like all capillaries, glomeruli are composed of endothelium cells and also basal lamina and vascular layers of the glomerular capsules. So the other filtrate, the main
Okay,
thing
thank you enough.
which do our
Thank you
kidneys.
enough.
Hello, sir.
Thank you.
Okay,
Thank you. God
sir.
bless you. Hamad
Okay,
Haris,
thank you, sir.
you can start.
Thank you, sir.
Okay, sir. Yes,
Okay.
sir.
You can start, Hamad Haris.
Okay, sir. Kidneys. The kidneys are a part of bean-shaped organs on either side of your spine, below your ribs, and behind your belly. Each kidney is about 4 or 5 inches long, roughly the size of a large fist. The kidneys' jobs to filter your blood. They remove waste, control the body fluid balance, and keep the right levels of electrolytes. All of the blood in your body passes through them several times a day. Blood comes into the kidney, wastes get removed, and salt, water, and minerals are adjusted. If needed, the filtered blood goes back into the body. Waste gets turned into urine, which collects in the kidney pelvis, a funnel-shaped structure that draws the tube called the ureter to the bladder. Each kidney has around million tiny filters called nephrons. You could have only 10% of your kidney working, and you may not notice any symptoms or problems. If blood stops flowing into a kidney, part of all could die. Kidney conditions. Polynephritics. Infections of kidney pelvis bacteria may infect the kidney, usually causing back pain and fever. A spread of bacteria from untreated bladder infection is the most common cause of polynephrotics. Glomerulonephrotics. An overactive immune system may attack the kidney, causing inflammation and some damage. Blood and protein in the urine are common problems that occur with glomerulonephritis. It can also result in kidney failure. Kidney stones, minerals in urine from crystal stones, which may grow large enough to block urine flow, is considered one of the most painful conditions. Most kidney stones pass on their own, but some are too large and need to be treated. Nephrotic syndrome. Damage to kidneys causes them to spoil. Large amounts of protein into the urine, leg swelling, edema may be a symptom. Polycystic kidney disease, a general condition resulting in large cysts in both kidneys that hinder their work. Acute renal failure, a sudden worsening in how well your kidneys work. Dehydration, a blockage in the urinary tract or kidney damage can cause acute renal failure, which may be reversible. Chronic renal failure, a permanent partial loss of how will your kidney works. Diabetes and high blood pressure are the most common causes. End-stage renal diseases, complete loss of kidney stones, usually due to progressive chronic kidney disease. People with require regular dialysis for cerebral. Papillary necrosis. Severe damage to the kidneys can cause cones of kidney tissue to break off internally and clog the kidneys. If untreated, the resulting damage can lead to total kidney failure. Diabetic nephropathy, high blood sugar from diabetes progressively damaged the kidneys, eventually causing chronic kidney disease. Protein in the urine. Nephrotic syndrome may also result. Hypertensive nephropathy, kidney damage caused by high blood pressure. Chronic renal failure may eventually result. kidney cancer. Renal cell carcinoma is the most common cancer affecting the kidneys. Smoking is the most common cause of a kidney cancer. Interstitial nephritics, inflammation of the causing acute renal failure, allergic reactions, and drug side effects are the usual causes. Minimal change disease, a form of nephrotic syndrome in which kidney cells look almost normal under the microscope. The disease can cause significant leg swelling, edema. Steroids are used to treat minimal change disease. Nephrogenic diabetics insipidus. The kidneys lose the ability to concentrate to urine, usually due to drug reaction, although it's really dangerous. Diabetes insipidus cause constant thirst and frequent urination. Renal cyst. A hollowed out space in the kidney, isolated kidney cysts often happen as people age, and they almost never cause a problem. Complex cysts and masses can be cancers. Kidney tests. Urinalysis, a routine test of the urine by a machine and often by a person looking through a microscope. Urinalysis can help detect infections, inflammations, microscopic bleeding, and kidney damage. Kidney ultrasound. A probe placed on the skin reflects sound waves of the kidney, creating images on a screen. Ultrasound can reveal blockages in urine flow, stones, cysts, and suspicious masses in the kidneys. Computed tomography scan. A CT scanner takes a series of X-rays and a computer creates detailed images of the kidneys. Magnetic resonance imaging scan. A scanner uses radio waves in a magnetic field to make high-resolution images of the kidney, urine, and blood cultures. If an infection is suspected, cultures of the blood and urine may identify the bacteria responsible. This can help target antibiotic therapy. Ureteroscopy, an endoscope flexible tube with a camera on its end. It passes through the urethra into the bladder and ureters. Ureteroscopy generally cannot reach the kidneys
Okay,
themselves,
enough,
but
enough,
can
enough,
help.
Alice. Thank you. I have meeting.
Okay, sir.
Everyone, good job.
Thank you.
Bye. See you. Tomorrow we have lecture, I think so. Okay.
Okay, sir. Okay, sir. Thank you so much, sir.
Ali Khaidar Khan. Asif Iqbal. Thank you. Bye. See you. Juma Mubarak.
Okay, sir. Thank you
Okay,
so much.
sir.